Okay, great. How are you?
Good, good. Nice to see you.
Very good to see you. We're going to start very soon because I like starting on time for the sake of the people that, go online on time. So just 1 second. Okay, so we'll start. I can't hear you. Just, oh, now.
Now, okay. I think it's just better. Okay.
Okay. Hang on. So hello, everyone. My name is Marie Hoffman. I'm an attorney. My main focus is estate planning, trusts, wills, and enduring path attorney. And I advise on mainly with people who have dual citizenship, US and Israeli. And from my exposure with this age group, I've realized that there are a lot of important issues that should be addressed that concern the elders. And so I've decided to host these talk shows with people who deal with or work with or advise on issues to do with elder law. And today we're talking to Esther Garfinkel, who has a MA degree in speech language pathology for NYU. And we're going to be talking about speech therapy for the elderly population. So first of all, thank you very, very much for coming online and discussing this with me. And why don't you introduce yourself, Esther?
Hi, my name is Esther Garfinkel. I live in Beit Shemesh. I've been working as a speech therapist, speech language pathologist for close to 30 years with a very wide range of clients, from a rehabilitation, preschool, daycare, in a hospital setting, in clinical setting. And most recently, I'm back to my love of working with the elderly at Melabev, which is an organization that gives services to clients with dementia in the community. There are a number of day centers where people can come in, for a morning, for afternoon. I work in the Beit Shemesh office, but there's also a number in Yerushalayim in different languages, and in Beit Shemesh as well. We have Hebrew speakers, English speakers, French, Spanish, Russian, and it's just it's an amazing place to work. So I'm really, really fortunate to be able to love to go to work every day.
That is very lucky. That is very beautiful. Be able to love to go to work every day. That's actually not work if you love it, right?
Exactly.
So, okay, so let's start. Let's discuss, can you give us sort of an inkling of what are the issues that can arise speech-wise or communication-wise with the elderly?
Okay, so in the normally aging elderly population, there can be a number of different things that come up. Communication can be impaired by hearing loss, by poor dental hygiene and poor fitting teeth, and in general, just not having the opportunity to speak with as many people as they used to be, especially during COVID. There was a big increase in depression amongst the elderly, and a regression in communication skills because the isolation was so hard. They just didn't have with whom to speak on a regular basis, which made it very difficult. In the elderly population, I work specifically with clients with dementia, but also many other issues can affect speech and communication, and swallowing, which I also deal a lot with difficulty swallowing. Anything from Parkinson's, from strokes, really anything can arise. And, the therapy it's not, we call it speech therapy, but it's more like working on communication and cognitive skills, depending on the client's level, and where they're at. And that will kind of guide the therapy. Like, you know, someone who is normally aging and maybe the muscles get a little weak, so they have difficulty, some dysarthria, some difficulty, you know, speaking or swallowing, is very different than someone who has Parkinson's or ALS or had a stroke, which is also very different from dementia patients. And so it really, really depends what's going on at the time. And that's where we would focus the therapy.
Okay. So what can be done, and how does speech therapy help here?
Okay. So speech therapy, in general, language and cognitive therapy is very useful in, number one, keeping up the skills that the elderly person already has. It's like use it or lose it. If you don't practice speaking and communicating, then it just becomes more and more difficult. We also at Melabev have a service where we go into the homes of people who, for various reasons, are not able to come to the center, and we focus the therapy around things that will help them be the most communicative, whether it's, you know, word games. Wordle is a big one, or crossword puzzles, word searches, or sometimes it's art, which uses a totally different side of the brain than language. And it's really great for self-expression. And then we can talk about it. What were they painting? What were they drawing? Even people who say, oh no, I'm not artistic. Once you start, then usually the conversation kind of flows from there. And music as well is a very great modality to use for therapy. It just takes you back to, you know, I'll hear an 80s song and I'll remember exactly where I was when I was hearing that song or singing that song. I actually have a home care client who was very depressed and very anxious, and it took a lot of time to get through to her. And one day she was telling me that her grandmother took her to see the Nutcracker. And as soon as I put that music on, you could see the transformation in her face. She was swaying and in time to the music, and she was so happy and smiling. It was really like seeing a different person. Another, it's an app that I really, really love to use, is called Recall Q. Is it okay if I can share it for a minute?
Sure. I think I need to add you. Hang on.
Okay.
So
the app, the app, you know, I'll show you the website, is basically a clock. All you need is a tablet. And I basically, you know, I use this with my own mother. It can be used for many, many different things. It looks just like a regular clock. It has the day, the time, the date, the time of day, which is more helpful than you would think. Sometimes my mom will get up very early in the morning, but it'll still say nighttime. So she knows that she can't take her morning pills, even if she's awake, because the tablet still says nighttime. Right. It can be used for sharing pictures, for playing music, to keep the whole family and everyone who is a caregiver apprised of different doctor's appointments or anything that they have going on in their schedule. And it doesn't look like something, you know, I don't know, therapeutic or anything out of the ordinary. So there's nothing to be, you know, embarrassed by, that they have to have something reminding them. You can send messages, but it goes for pictures, music. I love it. Video calls, you can set alarms. It's really, like, I think one of the best tools that I have found that helps everyone in the family stay in touch with the elderly people in their family.
Sounds awesome. Actually.
I just wanted to share that because it's been, in my own, for my own use, it's been really, really helpful.
No, it looks extremely helpful. Looks great.
Yeah.
You were talking about music, and there was this, at the time, there was this video going viral about this prima ballerina that had severe dementia, and she was not communicative at all. And one day somebody had the initiative to put on headphones on with Nutcracker. And suddenly, which was, I guess, a ballet that she was dancing in. And suddenly she didn't say a word. She just started dancing. She just had all the moves. She remembered she was sitting in the wheelchair, and you could see, as you said, transformation of the body. You could see light in her eyes. She was the ballerina then. And it was so beautiful to watch. So I can really
see that. I've seen that one. It's really amazing.
What about, how do you deal when people, don't want to cooperate, or they get upset and maybe a little bit aggressive, which is, but in particular with people who suffer from dementia?
Mm-hmm. So, that's a very common problem to have, a very common issue that comes up. I think that keeping the person as involved as possible in decision making, and just having them feel heard by the people around them, and not just, they're a person and intelligent, and they raised me, and just to say, well, Mom, listen, this is what we're doing. That's not really going to work. It's not really going to work in most cases. Even if in the end you do end up doing what is best for them, whether it's medically or their surroundings, or bringing someone into the home. I think that's more your area, Mirit, to help with that power of attorney. But involving them in the process so that they feel like, okay, I'm heard, and offering them choices whenever possible of what they want to eat, what they want to wear, where they want to sit, where they want to go, who they want to speak to, is really, really important. And I found that even if you're not doing really what they want to be doing, if they feel validated, their feelings and their thoughts were validated and heard, then I think it makes the process much, much smoother.
Yeah, I also relate to that. It was amazing. Yesterday, I went to see this special home for dementia, and the patients were there, or the people that lived there were there. And every time, somebody came up to us, so the first thing she did was address him with what he used to do. Like, this is Annie Cohen, for the sake of argument. And she used to be, a very important person. She used to be head of a school. She used to be a teacher of arts. She used to be, and you could see that the second she was validated, that woman, and remembered the way she used to be, she stood up straighter. She actually looked like, and she had this smile on her face. I'm not sure what exactly went through, but something definitely woke up there. And I think it's
exactly what gets through and what doesn't, but they're people, and you need to
absolutely
give them the respect that they deserve.
Absolutely. And you said, about also in law, when I prepare these enduring power of attorneys, I always remind the family members that even if, God forbid, it needs to be used, they have to remember that they're helping the parent. They're not overtaking the parent. They're actually helping him. And it's very important that they ask his permission before they do anything, or consult with him before they do anything. Even if they don't think that person understands, it doesn't matter, because you don't know. So yeah, I really relate to what you just said. Can you tell us about activities or games that family members or grandchildren or caregivers can actually play or use as a communicative maybe tool with the elder person?
Sure. Pretty much anything that they enjoy doing can be used as a way to communicate. If it's playing war with cards, or Uno, or checkers, or I have this game Spot It that I like. It has like 2 cards and circles, and you have to find the item that's the same on both cards. And that really requires like visual scanning and attention. And even for people that aren't so communicative and aren't speaking so much, there's a lot of things that you can do. Art, really any games can be used. Word games. Sometimes it's hard to find a bridge between kids and the grandparents, especially if they don't live so close, or as their grandparents, if their communicative skills deteriorate, it's a little hard to have common ground. So there's many things you can do that don't even require actually talking, or just listening to them, just sitting and listening. Ask them, say, hey, I learned about this in school today, or I did this today. What did you used to learn when you were in school? What did you hear their history and their stories. There's actually another website called Life Stories, and it allows you, it has like a guide, and it allows you to, it gives questions to ask, and within those, all the different phases of life, when they were little kids, when they were learning, when they got married, etc., all the way with their jobs through life, and put in pictures. And I did it with my mother, went through all of the questions. At the end, you can print a book if you'd like. And I heard so many things that I had never heard before. And I thought, oh, I know all of her stories by now. But there were so many things that she had just remembered. Also, humor is great. Everyone likes to laugh. And it always, if you can make them laugh by telling jokes or showing them funny pictures, then that's always something really good to do with them.
That's amazing. Any tips you want to add or stories before we end our discussion today?
I can say that the more you stimulate someone cognitively through language, even if it's just, pointing at pictures, if that's where they're at, or, giving an accurate yes and no response, any kind of cognitive stimulation is going to be good for communication as well. And the more you are able to talk to the elderly, hear their stories, as much as you can, and treat them with dignity and with respect, then I think you'll get a lot out of the relationship.
Well, that was a good ending. That was nice. I agree with that. I didn't get to do that with my grandparents, with one of my grandparents who was in a home and just stopped being communicative. And I don't think there was so much out there at that time, and the knowledge to be able to know what to do and how to act. So
right.
You know how to do and what to do, and to be able to communicate with your elder loved one.
Yes.
So, thank you very much.
Really, oh, thank you. Really.
And very pleasant. It was really
my pleasure. Okay. And if you get questions on anything to do with speech or swallowing, I'm happy to answer them.
I was just going to say, so Esther just said it for me. If you have any questions, please add them on the comments below, and I will make sure that Esther gets them and she'll be able to respond. So thank you very much, guys. Have a good night, and I look forward to see you in my next live. Thank you so much, Esther.
Okay, bye.